Stop scrolling. Do you think you know therapy? Think again. Hi, I'm Diana Adams, owner of Grit and Grace Counseling here in the Woodlands, Texas. And at Grit and Grace, we believe that therapy doesn't have to look like laying on a couch while you and your therapist pick through all your unconscious repressed emotions or analyze every detail of your childhood. At Grit and Grace, we believe that therapy can address the here and now, the thoughts that are motivating your behaviors, and we can address those to produce real life change. At Grit and Grace, we employ what's called cognitive behavioral therapy, or CBT. CBT has been proven efficacious in the treatment of disorders like anxiety, depression, PTSD, substance abuse, sexual disorder, disordered eating, and even can help manage chronic pain. CBT has been around since the 1950s, but it's also been evolving and can be an effective treatment for today's modern client. We want to help you control your thoughts so your thoughts don't control you. At Grit and Grace, we employ CBT and various techniques like a motivational interview. We use reframing, we go through self-talk practices, and we work on thought stopping. Now, in a motivational interview, we will ask you directed questions to help you consider what your hindrances are, what might be blocking your progress in therapy, maybe uncover some fears that you didn't know you had. When we work through reframing, we're going to take problematic, maladaptive thought patterns, and we're going to pull them out. We're going to analyze them. We're going to see if they're serving you. And if not, we're going to try and look at them from a different perspective. That would be a more effective, adaptive way of viewing them. Through self-talk, we're going to try and figure out what voice is talking to you in your head, and we're going to make sure it's telling you the truth. We're going to make sure that it's supportive and it's aligned with your goals that we've identified through the motivational interview. And next, we're going to work on thought stopping. Have you ever found yourself experiencing intrusive thought patterns that won't stop and they get away from you? Here at Grit and Grace, using cognitive behavioral therapy, we want to stop those thoughts and we want to replace them with thoughts that are empowering, are supportive, are truth-telling, and can enact and motivate real life change. But don't take my word for it. At Grit and Grace, we use cognitive behavioral therapy because studies have shown it works. Take, for instance, this study that was done in Switzerland. It's a fancy name, Interpersonal Cognitions as a Mechanism of Change in Cognitive Behavioral Therapy for Generalized Anxiety Disorder. Now, this is just a fancy way of saying, does managing your thoughts produce effective life change? And it turns out it does. We also want to look at the specific techniques we're using and know that they're based off of empirical evidence. Here we've got a study that was done in 2019 discussing therapeutic strategies and techniques in early cognitive behavioral therapy. And it turns out that the work we do, even in the initial session or the couple sessions after that, matter. We want to come together with you and form an authentic therapeutic alliance, which means our relationship matters. We're not going to sit in a seat and tell you what to do or how to manage your life or your choices, but we want to work together with you to make sure that your thoughts and your behaviors are aligned with your goals. If you act now, you can receive your first consultation here at Grit and Grace completely free. We want you to come into our office. We want you to sit with us for 30 minutes as we go through practice scenarios and try and discern whether or not we'd be a good fit for you. If we feel like we're not a good fit for you at Grit and Grace, we want to recommend you to a counseling practice in our area that would be. We care about your mental health. We want to support you the best we can. And we believe that cognitive behavioral therapy, because of the evidence in the empirical data and the studies and our client successes have shown us that cognitive behavioral therapy is an effective treatment for anxiety, is an effective treatment for depression, post-traumatic stress, and so many more things that we can address to help make your thoughts and your life better, more effective, and more aligned with the you want to be. Please give us a call today, and thanks.